In MBBS, one of the subjects that you have to pass is E.N.T, ear, nose, throat, Otorhinolaryngology. And perhaps the most important topic in this subject is chronic otitis media. Now, there are various things that you are taught about chronic otitis media, its definition, its types, the differences in the clinical features between the different types. But I want to only talk about the treatment algorithm, a very short and simple thing, which is there in your textbook that you're supposed to read during MBBS. This is a short algorithm which talks about the treatment protocol in chronic otitis media. So if you have diagnosed a patient to be suffering from chronic otitis media, that is a patient who has hearing loss, and you notice that there is a perforation, a hole in their eardrum, then the first thing you should look at is whether the patient has cholesteatoma or not. If the patient has cholesteatoma with chronic otitis media, then the treatment is surgery. What surgery? Usually modified radical mastoidectomy. If the chronic otitis media patient does not have cholesteatoma, then you have to pay close attention and observe whether the perforation is dry, whether the middle ear mucosa is inflamed or not. If the middle ear mucosa is not inflamed and if there is no discharge, no liquid in the ear visible, then you can call it a dry perforation, and after proper investigations you can go for surgery to correct the tympanic membrane perforation. You want the tympanic membrane to be completely intact. You don't want a hole in the eardrum. So that is also done through a surgery which is not mastoidectomy. Typically it is tympanoplasty. However, if the perforation contains moisture, discharge, secretions, or the middle ear mucosa is also inflamed, or just one of the two, then you should first prescribe medicines. Which medicines? Antimicrobials, ear drops or antimicrobial tablets. In very rare cases, you might have to prescribe antimicrobials through the intravenous route. That is very rare. And you also tell the patient to follow certain precautions. Don't let water enter the ear. Try to stay safe from upper respiratory tract infections because these are exacerbating factors. If water enters the ear, the infection may flare up. If there is upper respiratory tract infection, that infection can reach the ear through the eustachian tube and the infection can flare up in the ear. So these are the precautions one needs to observe. If the precautions are observed and the medicines are consumed, usually a wet perforation in the ear gets converted into the dry perforation. And now you can treat the patient in the same way. You can treat the patient with tympanoplasty. However, even after precautions are observed and medicines are consumed, even after that, if the wet perforation remains wet, then you are left with no other choice but to go for surgery before the perforation has become dry. But in this case, tympanoplasty may not prove to be adequate. You might have to combine tympanoplasty with mastoidectomy. So this was the treatment algorithm for chronic otitis media, and I hope this will help you answer all of your questions regarding the treatment of chronic otitis media when you are asked this question both in exams and by your patients.